Hello, welcome to part 11 of Clinical Physiotherapy MCQ series. Let's move to our 51st question. A physical therapist is teaching patient who has recently undergone knee surgery to descend stairs without a railing and using a cane. The patient is partially weight bearing on the right. Which of the following institutional method should the physical therapist use to teach the patient this activity? Option A. The therapist stands behind the patient and the patient descends with the cane and the left leg first. Option B. The therapist stands beside the patient and the patient descends with the right leg first and then the cane. Option C. The therapist stands below the patient and the patient descends with the cane and the right leg first. Option D. The therapist stands behind the patient and the patient descends with the left leg first. And the answer is Option C. The therapist stands below the patient and the patient descends with the cane and the right leg first. Explanation to this question is, neither option 1, 2 nor 4 is safe or appropriate. When descending the stairs, it is generally best for the therapist to position below the patient as the protection from the following. However, the patient should always descend the stairs leading with the inward leg, the right leg in this case, and the cane. Moving to our 52nd question. You are to perform an initial evaluation to a patient 2 weeks status post-rotator cuff tendon repair. The order are to begin the general strengthening of the rotator cuff muscles with the strengthening limited to shoulder range of motion 90 degree or lower. Which of the following muscle should not be emphasized in this patient's treatment program? Option A. Infraspinatus. Option B. Teres major. Option C. Supraspinatus. Option D. Subscapularis. And the answer is Option B. Teres major. Explanation to this question is, Teres major is not a rotator cuff muscle. Therefore, it would not be emphasized in a treatment program of strengthening of rotator cuff muscle. Infraspinatus, supraspinatus and subscapularis, which are rotator cuff muscles, would be emphasized in general strengthening program. Moving to our 53rd question. A physical therapist is working with a patient who has complete T6 spinal cord injury. The therapist has the patient perform seated push-ups on a mat by having the patient push down on the mat with both upper extremity and attempting to lift the buttocks off the mat. Which muscle group is being trained during this activity? Option A. Quadratus lumborum. Option B. Internal obliques. Option C. Latissimus dorsi. Option D. External obliques. And the answer is Option C. Latissimus dorsi. Explanation to this question is, the quadratus lumborum, internal oblique and external oblique are all innervated below the level of lesion. Internal oblique are innervated below the level of lesion. Sitting push-ups are often used as a preparation for gait training and transfer. The push-ups are done to strengthen the muscles that hike the pelvis or lift the buttocks from the mat in the seated position. In a patient with a complete spinal cord injury of T6 level, the only muscle group that is still capable of lifting the pelvis is latissimus dorsi, which is innervated by root C6, C8. The therapist is attempting to strengthen this muscle because they are capable of lifting the pelvis in the absence of erector spinae, abdominal musculature, which are innervated below the level of lesion. Moving to our 54th question. A patient is referred to physical therapy with a diagnosis of Yshak paralysis or palsy. The physician recommends a treatment program that will emphasize maintaining the range of motion and preventing the contracture. Yshak paralysis is a result of damage of which of the following nerve root? Option A. C4, C5. Option B. C5, C6. Option C. C7, C8. Option D. T1, T2. And the answer is Option B. C5, C6. Explanation to this question is, Yshak palsy is a result of damage to C5, C6 nerve root. Signs of Yshak palsy include loss of sensation in the arm and paralysis and atrophy of the deltoid biceps brachialis muscle. The typical position commonly seen in affected extremity is arm adducted, internally rotated, elbow extended and forearm pronated. The treatment emphasizes preventing the contraction and range of motion. Moving to our 55th question. A 22-year-old long-distance runner visits a physiotherapist because of consistent pain in her Achilles tendon. The physiotherapist performs the Thompson test to examine the integrity of the Achilles tendon by squeezing the calf. What does the positive sign of Thompson test indicates? Option A, Achilles tendon rupture. Option B, calcaneofibular ligament sprain. Option C, deltoid ligament injury. Option D, deep vein thrombosis. And the answer is option A, Achilles tendon rupture. Explanation to this question is a Achilles tendon rupture is a complete or partial tear that occurs when the tendon is stretched. That's all for today. If you need further clarification, check the description box and give your feedback in the comment box. If you like this MCQ session, do subscribe to this channel for more videos. Thank you.